I'm Dr. Mriganka Sekhar Sharma, Director of Surgery at CK Birla Hospital, Gurugram. Today I'm talking about the topic of obesity, yani motapa. Now when we talk about obesity, we mean a disease which we actually call the mother of all diseases. Now the important question is, how do we measure obesity? मोटापा या ओबेसिटी को नापने के लिए द पैरामीटर दैट इज मोस्ट कॉमनली यूज्ड वर्ल्ड ओवर इज बॉडी मास इंडेक्स. इट इज बेसिकली a ratio between the weight and the height and is expressed in terms of kg per meter square. Now normal BMI एक इंसान का होता है between 18 to 25. जब BMI 25 और 30 के बीच में हो जाता है उसको हम ओवरवेट मानते हैं. When it goes beyond a certain measure, उसको हम मोटापा यानी obesity मानते हैं. Now this is in itself a medical disease which requires attention. Now आजकल हम जब बात करते हैं मोटापे के बारे में तो we need to know कि when should treatment come into the picture. Now according to the guidelines that have been formulated by the Ministry of Health and Family Welfare, anyone whose BMI is more than 32.5 and has any associated illness like high blood pressure, diabetes, knee pain in females, problems like polycystic ovarian disease, these are patients which require treatment. Or if the BMI is more than 37.5, even in the absence of any of these medical diseases, they also require treatment. So the important parameters to remember are कि BMI measure कर दिया जाता है and 32.5 in the presence of any two medical illnesses or 37.5 BMI even in the absence of any medical illness. Now when we talk about treatment of obesity, there are various things that we can do, right? Now with the advent of newer drugs, we have added armamentarium in the treatment of obesity. So the various steps in the treatment of obesity include not only good diet and exercise. For people needing medical treatment, we have very good drugs, both tablets as well as injectables for the management of obesity. The next step, of course, is the intragastric balloon, which is also there in the management of obesity. And of course, the most trusted form of treatment is the bariatric surgery, which is offered only for selected group of patients. So as I said, obesity is a disease that needs to be treated, and we have various steps in the treatment of obesity. This includes exercise, drugs, intragastric balloon and bariatric surgery. Thank you so much.